Have you ever experienced joint discomfort that feels like your usual aches, but then suddenly, it intensifies dramatically, making you wonder what just happened? The core difference between everyday osteoarthritis pain and a flare-up lies in their intensity, duration, and underlying causes. Osteoarthritis pain is your persistent, chronic baseline discomfort, while a flare-up represents an acute and often temporary worsening of your symptoms beyond this usual level. Your daily OA pain typically results from ongoing cartilage degradation, bone changes, and low-grade inflammation within the joint. It is a constant companion, usually manageable with your regular routine and treatments. A flare-up, however, is a sudden, significant spike in pain, stiffness, and sometimes swelling, often triggered by specific events. These triggers can include overexertion, minor injury, stress, changes in weather, or even an infection somewhere else in the body, which can temporarily heighten your body's inflammatory response in the affected joint. To manage these distinct experiences effectively, it is helpful to recognize when your pain escalates from its usual level. For everyday OA pain, focus on consistent strategies like gentle movement, prescribed medications, and regular application of heat or cold. When a flare-up strikes, prioritize rest for the affected joint, consider short-term use of anti-inflammatory medications if approved by your doctor, and apply ice to reduce acute swelling and pain. Understanding this distinction empowers you to react appropriately and gain control. An interesting detail is how your pain threshold can sometimes lower with chronic pain, making even typical OA pain feel more intense during a flare-up. This heightened sensitivity means that the body's protective mechanisms are on high alert. Additionally, a flare-up often involves a temporary increase in the inflammatory cascade, which is a complex chain reaction of biochemical events that leads to more pronounced swelling, warmth, and pain-causing chemicals in the joint fluid. This is why a flare-up feels so much more acute. By knowing how to tell the difference between your routine OA discomfort and an acute flare-up, you gain a powerful tool for self-management. This insight allows you to choose the most effective strategies for the moment, helping you to recover faster from acute episodes and better maintain your quality of life overall, rather than letting pain dictate your activities.